All right, we'll start again. Good afternoon, everyone. Thank you for joining us for our weekly COVID-19 community update. I'm joined today by Monroe County Public Health Commissioner, Dr. Michael Mendoza, Dr. Michael Apostolakis, Chief Medical Officer for URMC Strong Memorial and Highland Hospitals, and Dr. Robert Mayo, Chief Medical Officer for Rochester Regional Health. We're going to start by checking in on our numbers. We're reporting today 183 new COVID cases, which brings our 7-day average of new cases to 164. Last week, we reported 213 new cases and a 7-day average of 193. We're still seeing fluctuation in those numbers, although they're on the downswing this week. That's good news for our community. However, we continue to be classified as an area of high COVID transmission according to the CDC. As for vaccinations, we keep making good progress. More than 461,000 Monroe County residents have completed their vaccine series, and about 494,000 have had at least one dose. That means roughly 5,000 more residents received their first shot over this past week. So about 77% of our eligible residents have had their first dose, and 73% have completed their vaccine series. Our mobile vaccine unit has been successfully deployed into our community, and we are working hard to get those life-saving doses to our most underserved populations. We have several vaccine clinics scheduled in neighborhoods throughout the city of Rochester in the coming days, as well as other locations throughout Monroe County. All the information on times and appointments can be found by visiting our website at www.monroecounty.gov/health or by calling our COVID hotline at 585-753-5555. Vaccination remains the best and most effective tool our community has to combat COVID-19. It's free, it's safe, and it works. If you're eligible and haven't had your shot, today's a great day to choose vaccination. We also have our $100 thank you gift cards available for vaccines at a number of our sites. This runs until the end of the month, September 30th. So you can see more information on that, again, at our website, monroecounty.gov. But please keep in mind, we have the $100 thank you cards available at a number of our vaccine clinics through the end of this month. Yesterday, the FDA approved booster shots for seniors and other people in high-risk populations. Our team is continuing our efforts to scout locations for sites to offer those booster shots as we await more information about when those efforts can begin. Meanwhile, we're continuing to hire administrative clerks, nurses, and EMTs and others to help get these sites up and running. We offer flexible schedules, both in terms of number of days and number of hours, as well as competitive pay that ranges from $17.50 to $28 an hour, depending on the job. You can find the details and applications, again, on our website, monroecounty.gov. And I know the state's vaccine mandate for healthcare workers is still a concern for many people who are worried about possible worker shortages stemming from healthcare employees who are leaving their jobs rather than getting vaccinated. Can make it harder to get life-saving medical treatment. I want this community to know that access to life-saving medical treatment will continue to happen. URMC released some great information earlier today about where they stand in terms of having healthcare workers meet the state's mandate. 99% of their professional staff and 91% of all hospital employees have gotten their vaccine so far. That is great news. And I am pleased to report that we see very similar numbers at Monroe Community Hospital, where just like URMC, 99% of our advanced practice professionals, such as physicians, nurse practitioners, and physician assistants have been vaccinated, and 91% of all employees at Monroe Community Hospital are vaccinated. And those numbers continue to increase as we approach the mandate deadline. We do have some agency staff at the hospital with lower vaccination numbers, but we're working very hard every day to encourage more vaccinations. We know the state is firm on putting this mandate in place, and the governor reaffirmed that yesterday while here in Rochester. So we have taken steps at Monroe Community Hospital to prepare for all possibilities. We have put a temporary pause on new admissions, reassigned some aides to clinical care, and trained other workers with new skills, just in case they need to be redeployed to support our clinical staff. Doctors Apostolakis and Mayo will talk more about possible impacts and updates from their healthcare system in a few minutes. But I want to be very clear here. There will be no interruption of critical healthcare needs. Our hospitals are open and ready to care for critical healthcare needs of our community. Yes, there may be some inconvenience in healthcare delivery and some contingency plans that are going to be executed as we approach the mandate deadline. But our healthcare systems have long been grappling with a shortage of staff, and that's only been exacerbated by COVID and the demands this pandemic has put on the people working in the system. I can assure you that essential and critical care services in our healthcare system will not be impacted. If you or your loved ones need critical healthcare services, our healthcare system will continue to deliver high quality care without interruption. The state, county, and healthcare systems will work together to ensure high quality care we enjoy now will continue with as little disruption as possible. But I need to add an important message here. Let's remember that our healthcare workers have been the front line in our fight against COVID for the last 18 months, a full year and a half. And this fight is not over. They are tired, they are stressed, and they deserve our gratitude. In the beginning of this pandemic, we were all very good about recognizing our healthcare heroes and the sacrifices that they make to care for our loved ones. Do you remember we put out lawn signs, we sent cards and letters, and showed up outside the hospital to demonstrate our appreciation? Now some of our healthcare workers look out the hospital window and they see protests and anger. To me, that's very disappointing. That's not support. COVID hasn't gotten any easier for our healthcare workers. In many ways, it's gotten harder and it's more exhausting because it's been unending. So on behalf of Monroe County, I want to say thank you to each and every healthcare worker who has taken care of us through these difficult days and who will take care of us in the days to come. I want you to know that you are still our heroes. I want to thank every one of you who has gotten vaccinated because you recognize that you have the power to end this. You know that the only way for this pandemic to end is for all of us to get vaccinated. And so now I'd like to turn this over to Dr. Mendoza.
Good afternoon, and thank you, County Executive Bello. And as I stand here with my colleagues, Dr. Michael Apostolakis and Dr. Robert Mayo, I have mixed emotions. On the one hand, I am incredibly grateful for the vast majority of my healthcare colleagues across Monroe County who will be reporting to work on Monday. We will be here to take care of our patients because that is what we all signed up to do. It is our calling, our passion, and our commitment. We are vaccinated against COVID-19, not because someone told us to, but because we know it is the best way to keep our patients and colleagues safe. And it is the best way to keep ourselves and our families healthy. We know that the Pfizer vaccine is FDA approved, making it no different than any other vaccine we would take without any question. We know all of the vaccines are safe and effective against severe illness and death for COVID-19. On the other hand, I am saddened because a small minority of my colleagues may not be joining us on Monday morning. I know there are many reasons for this, but there has been ample opportunity to research, learn, and understand the science behind these vaccines. There has been ample time to learn the facts and to overcome the fear. And I hope my unvaccinated colleagues use the next few days to really dig deep before choosing to leave this noble profession. Every one of you is incredibly important to this community. Every one of you is among the healthcare heroes of this pandemic. You stood firm during the hardest days. Getting a safe and effective FDA-approved vaccine is incredibly easy by comparison. But whatever you choose to do, I want to assure the rest of the community that we are not in a crisis. If you are ill, call your doctor. If you are sick or injured off hours or can't get in to see your own doctor, go to an urgent care. If your condition could be life-threatening, no matter what time of day or night, go to the emergency room. These healthcare services are not going away. My colleagues and I are going to take care of you. Will you see some changes in the provision of healthcare? Yes. Dr. Apostolakis and Dr. Mayo will have more to share about this in a few moments. But as we fully understand the limits of what we can do, we will be working on solutions because keeping our community healthy and safe is our job. It is our responsibility, and the vast majority of us are not going anywhere. Before I turn this over to the chief medical officers, I want to provide a brief update on our schools. We are seeing on average about 40 positive new cases per day in our schools. And for the most part, the students and staff who are infected are doing so outside of the school environment. Just like last year, schools continue to be very safe, provided that everyone is following CDC guidance, especially regarding vaccination and masking. I would be remiss in not mentioning the hard work and commitment of so many families, administrators, faculty, and staff. By and large, you are showing an incredible commitment to educating our children while keeping them safe and healthy. Thank you. We are working very closely with the schools to set up surveillance testing. And at this point, I am not concerned about the supply of test kits for the weeks and months to come, something I know other areas may be experiencing today. I'll be happy to address any questions related to these remarks after we hear from our colleagues, Dr. Apostolakis and Dr. Mayo. Thank you.
Thank you, Dr. Mendoza, and thank you, County Executive Bello. Dr. Mayo, always a pleasure to be here with you as well. And thank you, as always, to the news media. My statement will be brief because I understand that you've seen a news release we published today on the vaccination rates at UR Medicine and the impact of the state mandate. There are just a couple of points that I'd wish to emphasize. One is to echo what others have said. Vaccination is the most important step people can take to protect themselves, their families, and our community from COVID. I extend a wish from me and our entire URMC family to please get vaccinated. Our faculty and staff are stressed, and the one thing the community could do is get vaccinated. Higher vaccination rates mean fewer hospitalization and fewer deaths. The second is that the health systems across the country have faced staffing challenges for months. This makes it a challenge to maintain all of our services, even at pre-pandemic levels. As the state's vaccine mandate takes effect Monday, we will face some additional challenges. Patients are likely to experience some delays or inconvenience in receiving non-essential care. We ask for the public's understanding, but UR Medicine hospitals will remain open for business and ready and able to provide essential care. So if anyone in the public needs medical care or has symptoms or unsure about their symptoms, please call your doctor for advice and don't hesitate to visit one of our hospitals for care. Thank you. Dr. Mayo?
Yes, thank you, Dr. Apostolakis, Dr. Mendoza, and County Executive Bello. It's a pleasure to be here with you as always. I'd like to start by sharing just a robust, heartfelt thank you to the many thousands of healthcare workers who have valiantly served this community over the last 18 to 24 months. They have really shown their commitment through long hours of work and self-sacrifice. And without them, we would be in a much different place than we are today. I also want to thank the community members who also suffered and endured through this pandemic. I know that it remains difficult for you to have a loved one in the hospital and have restricted visitation hours, or be screened every time you walk into a healthcare facility. These changes in our usual patterns of life have been difficult to adjust to, but I appreciate all of the respectful acceptance and compliance that you have expressed over these months. It is true that the ongoing pandemic poses, an exhaustion factor for all of us, and it will and has permanently changed many of the ways that we are delivering care. But we're grateful that we can continue to serve this community. As Mr. Bello said, there is emergency services available, critical care services, and though there may be longer waits in some of our emergency departments, those services are available to this community, and we are committed to maintain those services. I'm also very proud of the vaccination rates of Rochester Regional Health employees. Those vaccination rates have been rising day by day over the past weeks, and they continue to rise day by day. And I'm pleased to say that Rochester Regional Health will be reaching very high percentages, nearing 100% for our employees over this mandate, this regulatory requirement issued by the state. I'm also grateful for the many people who are working overtime to provide care for this community. At times, there will be shifts in the services that we are able to provide. This will be assessed on a day-by-day basis, but it is possible that some of our laboratory draw centers and other facilities may have some restriction in their hours or changes in the location of services in order to consolidate services to ensure that this community has what it needs. So I'll turn the time back to County Executive Mr. Bello.
Thank you, Dr. Mayo. And Julie will manage questions.
Thank you, County Executive Bello. Our first question comes from Brian Sharp at the Democrat and Chronicle.
Thank you. This would be directed both to Dr. Apostolakos and Dr. Mayo. I was wondering, I guess for the URNC, the announcement was more than 23,000 have been vaccinated. I think, just quick Google searching, that leaves possibly around 3,000 who have not. Could both of you talk about which service areas in particular you might be concerned about going into next week based on the numbers you're seeing?
Right now, we have made contingency plans based on best in case, worst case scenarios. And our numbers are changing almost every day. We have made contingency plans to assure that essential services continue no matter how many or which types of workers aren't here on Monday. We at this point, it'd be premature to say that I'm any more concerned about one area other than the other than to say that we will be able to provide the essential services our community needs.
I think that's a very accurate, in the moment response, Dr. Apostolakos, and it's very similar for us at Rochester Regional Health. So, you know, there's a diverse workforce. Many of our workforce are cross-trained. So if there are major gaps in essential workers impacting care or services in one area, we plan to shift individuals to try and close those gaps. So I think the most accurate statement for the moment is for the public to check in with their healthcare providers if they have appointments scheduled, to ensure that schedules are on time, or if there's been changes in the location or the timing of the expected services. And we will support our patients, our community through all of that.
And for Dr. Mendoza, I was wondering, you mentioned about the schools, and we had talked last week about what you're seeing with people's buy-in, parents, students, for the, I guess, the random testing. Can you talk a little more about that? Have you gotten a better picture of what you're seeing across districts?
Well, as we had planned earlier in September, the schools have undertaken a process to survey their students, their faculty, their staff, to ascertain which students and faculty and staff would be open to being tested. We know that the unvaccinated students are required to be offered testing on a weekly basis, and the majority, if not all of the schools, public schools at least, in this county have elected to open up voluntary testing to all students. And so they're in the process right now of understanding how many of the students will consent, how many of the parents will consent on behalf of their children. And once we have those numbers in place, each of the school districts has a plan in place to determine how many of the subsample of those consenting individuals will be tested on a weekly basis.
All right, thank you, Brian. Our next question comes from Patti Singer at Minority Reporter.
I think we'll stay with Dr. Mendoza to start off here. He's all warmed up. In the data from Labor Day till the last set of cases by age came out, for the children under 10 and under 19, those cases had doubled from Labor Day to now. You did mention increased cases in schools and where you think that's coming from, but put that into some context. Are hospitalizations among children going up? Is it more serious illness? I mean, it's other age groups. The cases numbers seem to be the same, but that doubling in 2 weeks in kids seems to be alarming. Is it? Provide the context, please.
Well, we anticipated this to some degree because as college students came back to the area and as our K through 12 students went back to school, we anticipated there would be more testing in those age groups. So when you test more, particularly in an age category that is largely unvaccinated, particularly 11 and under is not vaccinated, it's not surprising that we'll see more cases. Thankfully, we're not seeing that translate into any significant increases in terms of hospitalizations. But remember, for hospitalizations in this age group, we're not ever going to be looking at huge numbers of hospitalizations. But what we are looking at, unfortunately, are very sad situations where otherwise healthy, individuals in their, teens and 20s and younger, who really should not be hospitalized for any other reason, if they contract a severe case of COVID, which does happen, that's certainly something that's going to be very troublesome for that family and for that individual. So we don't want to measure the burden of childhood cases only in terms of cases or even hospitalizations, but really it's those few individuals who are going to bear really a disproportionate burden of this illness. So the number one message, of course, is still to get vaccinated once you're eligible.
Okay, thank you. And for the health systems, I understand that elective surgeries at Rochester General are being suspended, but as we've heard numerous times, critical care is still available. But at what point, because of staffing delays or other reasons, does routine care then become critical and add more to the burden that is already in the health systems?
Patti, thank you for the question. I'd like to clarify one thing. Elective surgeries are not being suspended at Rochester General. There has been some rescheduling or reshifting of the schedule to lessen some of the tightness of that schedule. And we will continue to assess that each day. So elective surgeries are being performed there, and our ambulatory surgery centers are also providing surgeries. I'm sorry, what was the second part of your question?
At what point, with routine care has to be even delayed or rescheduled, at what point does that become critical, adding to the burden that you already have?
Right, yes, of course. And well, that has remained one of the key questions for this entire pandemic. And we did see and do believe that a year ago, when the routine care was routinely canceled or delayed, that patients later returned with health challenges that we would have hoped could have been avoided, or diminished. So we are very attentive to that. We are continuing to offer our ambulatory services. We have not closed any of our ambulatory practices at this point. So we intend to continue to offer patients services. If there's a change in that, we'll of course let our patients know. But at this point in time, that's not our action.
Right. Thank you, Patti. At UR Medicine, we have elected starting next week to not add elective cases. We haven't canceled any yet, in anticipation of not knowing exactly how many staff we will be losing as of Monday. But as I said previously, we have contingency plans to continue essential services as needed. If we lose a significant number of staff come Monday, it will impact elective procedures and surgeries. To what extent, it's still unknown, but we will be here to care for patients. Once again, the one thing that we know that can help is vaccination. As we sit here today, we have over 50 patients at Strong Memorial Hospital that are here because they have COVID. We have over 110 patients throughout our system. That's a significant number that are requiring healthcare, the majority of which would not be here had they been vaccinated. So the community can help us maintain the essential services we need to do and the elective services by getting vaccinated. And the question of what point exactly is going to trigger really depends on how many staff we lose.
Thank you.
Thanks, Patty. Smriti Jacob from Rochester Beacon, do you have a question?
I don't. I'm all set. Thank you, though, Julie.
Thank you. Racquel Stephen from WXXI, you're next.
Yes, thank you. Thank you, doctors and county executive. My question is in regards to the percentage of staff that have applied for exemptions or are exempted. In the release earlier today, it said that the percentages does not include those in medical and religious exemptions. Do we have a number of those who have received those exemptions or applied for those exemptions?
So the number at UR Medicine hospitals that have applied for exemptions changes each day. They're into the hundreds that have applied for exemptions, and more than 200 have had exemptions that were approved. But just because an exemption is approved, we have to find an accommodation that keeps them in a position that they're safe to practice or work in the hospital.
Yes, I would say from a Rochester regional perspective, we have granted several hundred exemptions based on the regulations and the criteria set forth in the regulations by New York State. And we will continue to, review those and carefully help our team members through that process.
Okay, I guess my follow-up question would be, what are, under what circumstances or what regulations are these exemptions approved? Because I know the lawsuit by Judge Heard stated that, is there any form of regulations, and does that lawsuit even apply now? Do we have any updates on this?
So right now, the medical exemption requirements are in place. Those have been established by Governor Cuomo's order when it was released, and then subsequently by the amendment by the Department of Health after the FIPIC review of that regulation. So that's been established. There was an FAQ that the Department of Health released to further explain the medical exemption process. The religious exemption process or criteria currently are being challenged as you are referencing. So there's a temporary restraining order on the removal of the religious exemptions, and so we are following general guidelines for religious exemptions that have been overseen by our legal department.
Exactly right, Dr. Mendoza, or excuse me, Dr. Mayo. We're both following the federal EEOC guidelines that have been promulgated. And what the court order was put a stay on the state mandate that we could not accept religious exemptions, and therefore we have to follow federal regulation.
Thank you. Next up is Jennifer Lewke from WHEC.
Good afternoon, everyone. I have a question for the heads of the health systems, please. I'm wondering, we've already seen some closures in urgent care settings. We've learned that several of the the places where you go to get your blood drawn will be closed or the hours will be shifted. How are you making determinations on what to close where based on the footprint of what you offer in this community?
Excellent question, Jennifer. But first, let me thank you for my promotion to the head of the health system. I appreciate that. I hope that comes with a raise. But to your question, it's very thoughtful, and we meet daily as leaders of our health system to discuss that. And how we choose is we try to choose services to close that will affect the least amount of patients and cause the least trouble or inconvenience for our patients and the health system. For example, we did have to close approximately 11 lab draw stations, but we tried to choose in areas that would have least impact or that there were other lab stations that were close. But it's really trying to get the most bang for our buck with our faculty and staff, looking at what areas could we close that wouldn't impact our patients, and then using those staff to keep other areas open and cause the least disruption in healthcare.
Yeah, it is a complicated process. And I will say that the experience last year of redeployment and additional training has set the framework and the foundation for our current approach to this situation. So we do a similar thing where at Rochester Regional, leaders meet daily. We review staffing trends, hot spots of concern, and then make decisions about do we, what is best for the community. And so in that framework, do we shift resources to that site to reinforce that site, or do we actually shift that site, combine it with another, or so forth? So thus far, this has affected very few locations, but we are prepared to continue that analysis day by day. I would dare say that few patients in this community will significantly notice these changes. There will certainly be some, and I think probably more likely than anything, people will recognize some delays in their care rather than that they've had to actually change locations. So we're very mindful of the importance of easy access, and we're committed to that. And so we are making these decisions with a great deal of caution and consideration.
And I wanted to ask about sort of the community-wide impact here. With 90% of nursing homes not accepting new patients, are those patients already starting to back up in the hospitals? What do you do with those patients who need rehabilitation or need extended care when you can't get them into a hospital or to a nursing home?
Yep, that is happening, Jennifer. We do have many more patients in our hospitals awaiting discharge for rehab or long-term care than we generally would have. And that is certainly a challenge, and it puts additional care burdens on the workers in our hospitals. We have good long-term care partners, and they understand that their decisions are not isolated and that we need to work as a team to keep sorting these challenges out. So yes, we are experiencing that, and there may be patients and families who realize that this is part of their circumstance, that they're waiting. In the meantime, though, we strive to continue inpatient rehab and other services for them, of course, that they would have otherwise received as an outpatient.
Yeah, thanks for that, Jennifer. My information tells me that 15 nursing homes in the area out of 56 aren't accepting new patients, but your point's just the same. Nursing home patients are backing up in hospitals. Less than 3 weeks ago, we had 15 to 20 patients that were medically stable, ready for nursing homes. Today, we have 43. It's a similar number at Highland Hospital. So you have 80 patients in our 2 hospitals in Monroe County that have stable patients ready to go to a nursing home that are still in our hospitals. This does cause added stress, but we're doing what we can to care for those patients in the most effective way possible, which is staffing ratios that meet their needs. But what we can do, or anything that we can do to help shore up our nursing homes and allow them to accept patients would be appreciated. And we're looking at opportunities to work with them in doing so.
Jennifer, I'll just put a plug in here. There are a lot of jobs posted in nursing homes and in hospitals for folks who can learn initial caretaking skills, patient care technicians and others. And we invite the community and folks that need extra income to look at these jobs. They're good jobs, and they have experienced leaders that will help through the communication and the ongoing process. We welcome.
Yes, and as long as we're putting plugs in, I'd like to give one plug to all the healthcare workers in the area that are on the fence about whether they get vaccinated or not. Up through Monday, 5 p.m., you can get vaccinated and either start working or come to work. So please consider vaccination and get vaccinated by Monday.
Okay, I think we're ready to move on to our next question. Mr. Rose from Spectrum News.
Hi there. My question goes to the hospital systems. And I know among the medical staff, the vaccination rate appears to be really, really high. But obviously that's causing some concerns with the small percentage that could be leaving. Do you all have a number of how many people have left, how many people you think will leave? And my second question is, do you have a plan in place to get new staff in the door come Monday? I know the governor mentioned something about a plan. Do you all have any plans as hospital systems?
Great question. As of yet, it hasn't been very many. I don't have the exact many of people who were resigned, but we do have hundreds of people at Strong that haven't told us one way or the other. So I don't know exactly how many, but we do have plans for anywhere from a low number of people not to get vaccinated to a plan that's a worst case scenario where several hundred people decide not to get vaccinated. So the contingency plans are in place to be able to continue with the essential services and the things that our community needs. As I said previously, some elective procedures and cases may get canceled, but hopefully we can get them rescheduled soon. As far as recruiting more staff, I can tell you that UR Medicine has been actively trying to recruit staff, even starting before the pandemic and through the pandemic. This is a nationwide issue with people leaving healthcare. The stress of the pandemic has caused people to leave and less people to come in. And so there are more and more institutions looking for relatively fewer healthcare workers. But we're doing all we can to recruit staff with competitive wages, benefits, and everything that we're doing here at UR Medicine to be part of our team. So we're as active as we can be in recruitment.
Yes, Mr. Rose, that's an important question. At this point, from a provider staffing standpoint, physicians and advanced practice providers, we're seeing that number, fall to extremely low levels. We're still actually counting it, but it's probably going to be almost unnoticeable to the clinical operations because our provider staff has really stepped forward and been willing to be vaccinated. But for providers who, for the very few, for the handful who are saying that they have no intention of being vaccinated, we are letting them know today that we will begin talking with their patients Friday and Saturday to reschedule anything that's scheduled for Monday so that we can get them into a new schedule, but just give us a few days to adapt. So there may be a very few individuals in the community that experience that kind of a rescheduling process, but I'm very grateful that that's going to be a very small number of people. So more to come on that. And as has been said earlier, this number is changing every day, and we have folks reconsidering and joining the ranks of the vaccinated so that we can move forward as we need to for this community.
And just one quick follow-up question. This could be for the hospital systems or Dr. Mendoza. I guess, would it appear as though that the outcry about this vaccine mandate for healthcare workers is a bit louder than the actual number of people who have gotten vaccinated versus who aren't willing to get vaccinated in the hospital system?
So I'll start by saying that I think this is a very vocal minority. The vast majority of my colleagues, and I've been in the hospital for the last week taking care of patients as well, the vast majority of my colleagues have stepped up and have done the right thing. What we're hearing about is a small minority of people who've forgotten what we're fighting for. We're fighting for the health and safety of our community. We're fighting against the COVID-19 virus. We're not supposed to be fighting with one another. And I think what we're hearing is unfortunate, but I do think that we will rise above this. But I would love to see those who are on the fence in healthcare who are not yet vaccinated to dig deep and think about why they entered the profession in the first place. Because we're here to help our patients and to help our community. And this is an opportunity like no other where we can all step up and speak with a unified voice that we care about Monroe County and we care about our patients.
And I would just like to echo that the vast majority of our faculty and staff are 100% behind the vaccine and what the vaccine does for our patients and community. And it is a vocal minority that oppose the vaccine.
Yeah, without question. Yeah.
Okay, thank you. Our next question is from Jayne Chacko from 13 WHAM News.
Hi, my question is for the hospital systems. I saw the URC numbers that the percent of all hospital staff is a little bit lower than the medical professionals. Does that include staff like janitors and secretaries, all of those staff too? And is that going to impact operations at all? And that's also for if we're seeing that at our age as well.
Yes, great question, Jane. It does include anyone that works in our hospitals or any of our Article 28 sites. So it does affect our OAS or staff. It does include our environmental services staff. And this is why, part of the reason why we're asking our patients and their families to have patience, that they may be in line longer, waiting to check in. It may take a little bit longer to get through their healthcare visit, but we're here to serve and take care of our community. We want to work with you, and we ask the community to just be patient and understand we're doing everything we can to take care of them as efficiently and effectively as we possibly can.
Jane, it also includes at Rochester Regional Health, individuals that work in finance or that work in IT, or so it is a very comprehensive measurement. And at Rochester Regional Health, those percentages are well into the mid to high 90s, and so we hope that number will continue to approach as close to 100% as it can go. So day by day, it's rising.
Thank you. And for Dr. Mendoza or Adam, I wanted to ask you about any support for nursing homes, since we know that they are experiencing multiple hurdles right now. Is there anything that could be coming, anything from the state?
They've been experiencing hurdles for quite some time, even predating the COVID-19 pandemic. And our long-term care facilities, our nursing homes have been understaffed for quite some time. So I think that's why, the adjustments you're seeing now, and I can speak on behalf of Monroe Community Hospital, the adjustments we're seeing now are in anticipation of what may or may not happen next week. We don't know where staffing levels will rise, so we need to make sure that we're prepared to be able to appropriately care for the individuals that we're entrusted to care for, who are currently at Monroe Community Hospital. But we've also acknowledging that there is this long-standing problem with the leadership at Common Ground Health Dr. Mendoza and I announced several months ago the beginning of a task force to really try to look at bringing together not just the long-term care facilities, but also the educational institutions and other community leaders to look at it more globally, because you can't just solve a problem when you're just in a crisis situation. We have to look at the long-term problem, which is how do we incentivize more people into the healthcare system? How do we incentivize additional staffing, career ladder opportunities, and frankly also funding, because our nursing homes have been underfunded for quite some time. And, you know, what we've seen now when you get into COVID-19 here and the challenges that they face is that it puts this incredible amount of additional stress on those facilities, and particularly the staff that's working those facilities as well. And so the long-term care task force is meeting now. It's really looking at how do we address those long-term issues. And here in the short term, we're making those contingency plans and adjustments that are necessary to make sure that they're receiving the standard of care that they've come to expect from us.
And the one thing I want to add is that nursing homes, like other hospitals and diagnostic and treatment centers, are governed by the state health department. And so we don't have the ability at a local level to issue waivers and other relief because all of those need to go through the state health department and ultimately the governor's office. So we are working locally to try to be more efficient. I've met with my colleagues to see if there are ways that we can offer telemedicine opportunities so that we can help patients who are in nursing homes or in more specifically assisted living facilities who may need an ER evaluation. Is there a way that we can evaluate them where they are located rather than having them go to the hospital, because the vast majority of them will need to come back to the nursing home? So are there ways to be more efficient with what we have? And so those conversations have been ongoing, but ultimately I think the state may come in and determine that there are waivers that might be necessary at a state level. And if that time comes, we'll be happy to evaluate what's coming.
Thank you. And we have Bobby Calvin from the Associated Press joining us today. Mr. Calvin, do you have a question? You're on mute if you're trying to speak.
Actually, I do not have a question.
Okay, thank you very much. And our final question today then comes from Christian Garzone from WROC.
No, we would welcome them to come back is the answer. So we know that that everyone is thinking through this day by day, and that people may change their minds, and we want people to know that they are welcome back. And whether they get the exact same shift or the exact same position, I can't say that in this moment, but yes, they will have a job, and we'll get them back into the workforce.
Great question, Christian. And we would welcome them back to our team at any time that they decide to comply with the vaccination mandate.
And the same goes at Monroe Community Hospital as well.
Thank you.
And that does it for questions. Anything else, County Executive Bello?
No, I'm all set. Thank you so much, everyone, for joining us today. Have a great rest of your day.
Dr. Apostolakis and Mayo, can I just ask, do you have a full list of the 11 or the blood locations that'll be closed that we can present to our viewers, just so they have an idea of where those closures will be?
I know they're going to be on our website, and I'll ask our public relations to reach out to you with the sites.
Okay, great. Thank you.
Yeah, Jennifer, I know I asked that question earlier today because there's a plan, but we're not sure it's going to be identical to that plan on Monday. They are putting it on the website on Monday, but we can get that to you.
Okay, great. Thank you.
Thanks, Jennifer. Thanks, everyone.
Great. Thanks, everybody. Have a good afternoon.
Thank you.